रिजल्ट आ गया पर हमारी चैंपियन नहीं आई अब तक।
बिल भरने के पहले तो आएगी ना।
सो गर्ल्स, क्या हो रहा है?
बिल हो रहा है। चल अपना कार्ड दे। पिन दे।
RBI कहता है अपना पिन, OTP, CVV या इंटरनेट बैंकिंग पासवर्ड किसी को ना दे। ऑनलाइन बैंकिंग सिर्फ अपने ही कंप्यूटर, मोबाइल और सिक्योर नेटवर्क से करे। हाँ, ये खाने की चैंपियनशिप थी क्या? RBI कहता है जानकार बनिए, सतर्क रहिए।
Hello and welcome. I'm Ramesh Ramachandran and you're watching the third installment of a special broadcast here on DD India. I'm sure you are aware that the coronavirus pandemic has plunged the world into a crisis. Thousands of people have died worldwide, including in South Asia. Governments are scrambling to contain the spread of coronavirus. Now, we at DD India want you to take proper care of yourselves, follow guidelines, advisories and protocols, because combating COVID-19, the name given to the disease by World Health Organization, requires collective, concerted action. Remember, we are all in it together. Now, two special guests join me in the studio. They look at the intersection of politics, economics and diplomacy so that you, the viewer, know what it takes to be on top of the news. Let me introduce them to you. Ambassador Dilip Sinha, who has served in the Indian Foreign Ministry, and Subimal Bhattacharjee, a columnist who has more than a passing interest in technology. Gentlemen, thank you so much for joining us on this special broadcast. Appreciate it. Thank you. All right, let's get started. But first, allow me to bring you up to date on the news so far. Now, all examinations, including those conducted by CBSE, that's the Central Board of Secondary Education, have been postponed till 31st March in view of the coronavirus outbreak. Human Resource Development Secretary Amit Khare has said that while maintenance of academic calendar and exam schedule are important, the safety and security of students who are appearing in various examinations, as also of their teachers and parents, could not be overlooked.
We have decided that all examinations, CBSE, NIOS and university exams, they are rescheduled and postponed till 31st of this month. Similarly, the evaluation work is also postponed till 31st of this month, because there are certain competitive exams like JEE mains where students have to travel to different centers, many a times outside their cities. Therefore, the JEE main exam will be held a little later. It was to be held from the first week of April. That new date for JEE exam will be announced on 31st March after assessing the situation.
So as you heard there, IIT JEE, the Indian Institute of Technology Joint Entrance Examination have been rescheduled. The new date will be announced on 31st March. Now what is to follow next is essential viewing. Please pay attention because it's important to know your facts. The COVID-19 virus can be transmitted in areas with hot and humid climates, fact or fiction? Well, from the evidence so far, the COVID-19 virus can be transmitted in all areas, including areas with hot and humid weather. Regardless of climate, adopt protective measures if you live in or travel to an area reporting COVID-19. Question number 2. How effective are thermal scanners in detecting people infected with the new coronavirus? Now, thermal scanners are effective in detecting people who have developed fever, that's have a higher than normal body temperature. Now, just to remind you, normal body temperature is 98.4 Fahrenheit or 36.9 degrees Celsius. But, and this is an important but, a thermal scanner cannot detect people who are infected but are not yet sick with fever. That's because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Question number 3. Do vaccines against pneumonia protect you against the new coronavirus? The answer is no. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine. Question number 4. Does the new coronavirus affect older people or are younger people also susceptible? Now, people of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. The World Health Organization advises people of all ages to take steps to protect themselves from the virus, for example, by following good hand hygiene and good respiratory hygiene. Number 5. Are antibiotics effective in preventing and treating the new coronavirus? The answer is no. Antibiotics do not work against viruses. They work only against bacteria. The coronavirus, as the name suggests, is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. But if you are hospitalized for COVID-19, you may receive antibiotics because bacterial co-infection is possible. And finally, are there any specific medicines to prevent or treat the new coronavirus? Now, to date, there is no specific medicine recommended to prevent or treat the coronavirus. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illnesses should receive optimized supportive care. Now, some specific treatments are under investigation and will be tested through clinical trials. The World Health Organization is helping to accelerate research and development efforts with a range of partners. All right, now that we have sifted fact from fiction, let's now take a look at the do's and don'ts. Now, the do's include frequent washing of hands, covering your face while coughing and sneezing, throwing used tissues in waste bin, seeing a doctor if you feel unwell, and avoid participating in a large gathering. The don'ts include close contact with a person experiencing cough or fever, touching your nose, mouth or eyes, and spitting in public. Now, social distancing is the new catchphrase. The Indian government has told states to shut schools, gymnasia and cinemas. It's encouraged private companies to let its employees work from home where feasible in an effort to reduce the possibility of spreading coronavirus infection within the community. Now to some international news. As the death toll crossed 100, the US announced strict measures and curbs to contain the coronavirus. The US province of Washington reported 6 new fatalities, bringing the country's total to 103. It means that all 50 US provinces have now been hit by the virus. Meanwhile, the US Central Bank has cut rates to avoid a recession. Nick Harper reports from Washington, D.C. Take a listen.
It's been a weekend unlike any other, and Americans are being told it's only going to get worse. Many people have been avoiding large public places. We've seen museums, churches, libraries closing down, and there's been no sports to watch on TV. And as we head into the new working week, this is where things stand. Top public health officials at the CDC, the Centers for Disease Control and Prevention, are recommending that there should be no public gatherings above 50 people. So if it's larger than 50 people, they're saying it simply has to be cancelled for the next 8 weeks. New York City is seeing some of the most aggressive measures being taken. There, all bars, restaurants and cafes are being told they have to close down. They can only offer takeaways and delivery services. And clubs, cinemas, theatres, they've all been told they have to close as well. Supermarkets, we're beginning to see reduced hours and, of course, coming with that, panic buying. But the president is telling people that they don't have to hoard essential items. At a press conference earlier, he said, take it easy, just relax. As for schools, we're beginning to see more closures. 29 of the 50 US states have now enforced public school closures. In New York City, that will be beginning on Monday and will last until the 20th of April. All in all, affecting about 25 million people countrywide. And the economic pressure, of course, is being felt. The Federal Reserve has been trying to ease that. In a shock move on Sunday, they reduced interest rates by 1%, bringing them down to 0% in total. But the thinking is that Wall Street will still drop at the open, potentially by as much as 1,000 points.
Across the Atlantic, UK Prime Minister Boris Johnson has announced the closure of all schools and advised nurseries and 6th grade to close as well. It comes as 30 more people died, bringing the total number of coronavirus deaths in the UK to over 100. Pressure has been growing on the UK government to act, and now its chief scientific advisors say it's time to send children home. Stuart Smith has more from London.
This was a move that the government has planned for and was ready for, but it didn't expect to have to make this move quite so quickly. And that's because the virus is moving through the country much faster than models and the chief scientific officers have predicted. So from Friday afternoon UK time, schools across the country will be closed. But not for all pupils. That's very important. Boris Johnson said that pupils whose parents are in key industries like doctors, nurses, delivery drivers, those pupils should still attend school so that their parents can still attend work. These areas vital in the coronavirus pandemic to keep the economy moving and to keep the healthcare sector going. But, he stressed, do not send children to grandparents, as they, of course, are very vulnerable to the COVID-19 virus. Some children very happy, they have time off school, but many very anxious, because for a lot of them, summer exams would have been coming up in May or June. The government said, don't worry, we will sort it out, but they haven't yet given any details as to how the results of these exams will be determined.
All right, let me turn to my guest in the studio, Subimal Bhattacharjee and Amb, Dilip Sinha, for more on this developing story. Subimal Bhattacharjee, how has this coronavirus epidemic or pandemic affected or impacted corporates in their behavior, in their practices? Could you take our viewers through the impact in India and around the world?
Thank you, Ramesh. I think one of the very significant aspects that we are watching right now is how corporates are very quickly turning towards work from home. Now that's the most visible aspect of the whole effort that they have made at this stage.
Right.
Now if you see today, technology allows you to function from any geography and intermingle and work or co-work together with anyone from any geography. So I think we are taking advantage of that. India's whole story around even the IT industry, onshore, offshore, both have now become a seamless story and a seamless success story, where we have leveraged technology to that advantage. And the government is also very much supporting such a move. In fact, even if you see the Prime Minister's effort to reach out to the SAARC leaders through video conferencing, I think it's one of the very visible ways. So this is where the work from home activity has increased in all of the Indian cities. Mind you, the IT and the BPO industry have a significant impact also today on India's GDP, 7.9% today, and it's expected to grow to more than 10% around 2025. And if you look at the contribution of the Indian IT industry to the whole world, which by and large is responding with work from home and other measures that depend on technology. Now, if you look at the growth even for the last 1 decade, we have had a compounded annual growth rate of more than 7 to 8% in this sector. Even the 2008 world economic crisis didn't impact the IT industry, and that's where last year, we exported US dollar 138 billion of software and related services. Now, looking at the landscape now, where across the world the economy is going to be impacted, there would be a lot of emphasis to see that corporates and institutions keep on running, and this whole concept of remote logins, providing services and solutions from a distance, I think this is something that we could take advantage of. We are already ourselves adapting to it. The corporates are taking care of it, and I think we will respond more as and when time comes.
Absolutely. Mr. Sinha, this is one issue which requires international collaboration. No country is immune from this pandemic, so India included would have to work with countries around the world. Prime Minister Modi has initiated the video conference with SAARC leaders. The G7, the EU are also responding similarly. Prime Minister Modi has spoken about involving the G20 as well. What do you make of India's diplomatic outreach to contain and combat coronavirus?
This crisis has already become the biggest crisis the world has seen since the Second World War. and it is certainly the biggest hit that globalization has taken in this world. Now, over the years, countries have become used to a certain style of functioning. Companies that got used to a certain style of functioning. You asked about the impact on companies.
Right.
The supply chains have been disrupted. This philosophy of just-in-time maintenance of inventory has been disrupted by this. The way leaders interact has also been impacted, because what had become of international diplomacy was interpersonal diplomacy, where leaders would meet at summits, hug each other, and then discuss international issues.
Right.
Now this has taken a big hit. So now leaders have to get used to the idea that they can interact only on the internet, on Skype, and through this long distance conversations, which in different languages is often a problem. Then there's also this issue of cooperation that you mentioned, which is extremely important, because today you have the movement of people is getting disrupted, not only of goods and services, but of people is getting disrupted. Countries are taking action, like for example, the US banned the flights from European Union, which is a close ally of the US, without consulting the European Union. So whatever action a country takes impacts its own people and other people in other countries.
Absolutely.
So obviously a lot of consultation is required. The international transport sector, especially the aviation sector, has been very badly hit. There are reports that by the end of May, most airlines will go bankrupt. So this is going to impact globalization as we know it today. So in this kind of a situation, the initiative of India to cooperate with other countries, not only in the immediate neighborhood, which is extremely important because people move across borders, especially in South Asia, well, other countries also, but also with other leaders, because we need to have not only do we have to look jointly for a cure for this inoculation, a vaccine for this disease, but also whatever action a country takes impacts other countries. So they have to work together.
Indeed. Subimal Bhattacharjee, you spoke about how companies are encouraging their employees to work from home. Some are segregating their employees, their workforce, into two distinct teams. 50% work from their respective offices, others work from home. So these are all measures, innovative measures, some would say, to help overcome this immediate crisis at hand. But other than that, you think this has prompted a behavioral change in corporates and individuals alike, in the sense that people are discouraged from air travel? They would rather stay put in their offices or homes to talk to their counterparts around the world. Working from home, e-learning is also catching up. So in your estimation, is this change in the way you and I communicate, in the way people communicate, is this going to be the shape of things to come going forward?
Yeah, I think it's impacting significantly behavioral patterns among humans. As you know, man is the most important social animal. So we all like to socialize, and even in terms of business deliveries also, to a great extent socialization helps. In spite of technology, in spite of video technology, still you have physical board meetings, still you have corporates, people traveling from one place to another. So I think these are some of the changes that we are adapting. We are forced to adapt. These behavioral changes are something that we will have to live with. I can't say at this stage today if it is of a big advantage or not, but I would think that we are adapting, and we will have to adapt just so that the humanity survives this kind of catastrophic disease, which still doesn't have a vaccine or
I'm sure you consult all these corporates. So what would be your advice to them to tide over, mitigate the current circumstances in terms of better optimal utilization of their workforce, human capital, human resources, to maintain safety at the same time, not affect their respective businesses?
Yeah, I think this is an opportunity, and to look and optimize the resources at their disposal. I think that's where people are doing work from home, then alternate days, alternate shifts, and everyone might have to also scale down to a certain extent depending upon where the response is coming from. So everyone is conscious of the fact, because as Ambassador has also said, that we have been inured to a certain lifestyle and way of doing business because of globalization. Much of the corporates have a significant involvement in supply chain or service delivery to the other world across the globe. So somewhere that level of adaptation has to be taken, and every corporate is conscious of the fact. They are also conscious of the fact that the human resources at their disposal, even they cannot be easily dispensed with, or they cannot also be made to become a victim of this disease or something that is coming as a big threat to all of the efforts. So I think everyone is conscious, and everyone will have to look at it optimally, even in terms of how to move ahead in the next few months.
Indeed. Ambassador Sinha, Prime Minister Modi has invited G20 to hold a virtual summit that might happen in the next few days or early next week. But given the initiative taken by Prime Minister in talking to SAARC leaders in the G20 outreach, is there scope for collaboration in the immediate term for countries, including India, to collaborate and join hands in the united fight against coronavirus, in terms of maybe having a corpus of funds to make use of, or even technology and vaccine research and development? So is that something that G20 would be the appropriate forum to get all these things done in the near term?
Well, the G20 was set up, as you know, as a group of countries which are the largest economies in the world, and it was meant to help them synchronize their economic and financial policies to promote global growth. In this case, since it's a medical issue, the most important organization is, of course, the WHO, the World Health Organization, which is taking the lead role in informing countries about the precautions to be taken. One of the good things that happened this time is that China has been very conscious of its responsibilities as a country and country of origin of this particular virus, which is different from how China had reacted in the case of SARS about 2 decades ago, when they had refused to share the virus itself. This time they were aware that this virus had to be shared, so their cooperation with the WHO has been extremely mature, and the WHO has appreciated that, and that is very important for all countries to cooperate with WHO in this. For the governments, it's important that governments realize that this virus has to be taken seriously.
Right.
The highest price has been paid by countries that have taken this thing lightly. China took it lightly in the last year. It broke out in November. Till December, they had not become serious about it. Similarly, in Europe, they thought it was an Asian thing. It won't happen in Europe, and Europe today has become the epicenter of this disease. So what governments and people have to realize is that this is a serious matter. It's a global crisis, pandemic, and governments must wake up to this. And even if one government is careless, it will impact others as well. And this is what the G20 needs to do, as it did in the case of the global financial crisis earlier, in activating all the governments and getting them to cooperate with each other, be it when they are introducing border controls, or be it when they are taking economic measures. There shouldn't be a race to the bottom of interest rates, which has already started with the US, or in the case of oil prices, or in the case of the aviation sector. So in all these cases, it's important for the leaders of the largest countries to get their heads together. They can't get physically together, but they can at least talk to each other to ensure that they take coordinated action.
Indeed. And if I can talk a bit about the service sector, for instance, tourism, hospitality industry, IT services. Ambassador Sinha spoke about the SARS episode in 2002, 2003, and then we had the Middle East respiratory syndrome in 2012. Now, my question to you is, I'm curious to understand how the industry coped then and now, and have we learned any lessons at all from our previous episodes or previous experiences?
I think MERS or even the current outbreak of COVID-19, they have their significant difference, but always you are at a learning curve. Basically, when you are dealing with such a kind of scenario, which first and foremost impact the service industry very well, now you have a set of protocols by which you run a service industry, and you also have a system and a concept of backups that you do, or disaster recovery methods that you do. So I think many of the lessons that have been learned from the past, they are definitely under consideration. But as this current spate of this coronavirus, until and unless the whole scope of this disease, specifically what is the source of the disease, how did it come, the different stages that we are in. Has it actually gone away completely
Right.
from China, or there is a way that again there could be a circular impact and then the cascading impact in the different economic setup. I think these are some of the things that will be very dynamically evolving, and as and when we'll respond. But some of the
Right.
steps that you take when you foresee something coming, are more or less precautionary, and some of them also have to be a little bit more stringent. So far, we have flagged some of the steps that we should take. For example, you laid out all the do's and don'ts, but beyond that also there are many things that possibly we could also see. Neighboring Bangladesh has just put across that anyone who comes back to the country with a 14-day quarantine and fine and imprisonment if it is not followed. Now, whether that would come to many other countries, these are some of the things. I think it will evolve, but ultimately it is a question of wait and watch and act as the scale or
Indeed. And one quick follow-up question before we wrap it up. Unlike, say, the SARS episode or the MERS episode, coronavirus has broken out in the age of social media. A lot of speculation, wrong information doing the rounds. So what is it a boon or a bane from your perspective?
I think it's very interesting. A lot of people have been writing in social media whether the positives are on top or the negatives. But if you see the pace at which information about the disease has spread across the world to the remotest corners has alerted a lot of the citizens. And mind you, today a lot of people are more trusting their handset than even what their neighbors would say or the family members would say. So this is also a reason where a lot of the fake news that is propagating on coronavirus, we already have made some arrests. We have applied our Disaster Management Act Section 54 to look at this. So I think wrong information will continue, but at the end of the day, we are also now judicious enough to believe what could actually be a best practice. No one is stopping away from washing your hands. That's the practice you have to do. But if someone says that cow urine will only solve your problem and all, that might not be taken by everyone. So we also will use our discretion to judge.
Right. Fair point. Ambassador Sinha, you get the last word. Your thoughts on how India should negotiate the next few critical weeks?
Well, we have to ensure that we do not import that is already coming from outside, but there is a large Indian diaspora outside.
Right.
Now, at this time, when almost all countries in the world have been affected by it, it is probably best for people to stay at home rather than we trying to get back our people, in which case we are importing larger numbers. Because no country is immune from this disease, so it's best that people stay where they are and not spread the diseases around. And it's also important for us to look at the economic impact of this disease, because our economy is being very badly hit. So we'll have to look at that, so that ensure that the burden of this, the cost of it, is borne more equitably by the entire population and doesn't hit only some sectors and some sectors of the people.
All right, Ambassador Sinha and Subimal Bhattacharjee, thank you so much for joining us on this special broadcast. Appreciate it. Thank you. Thank you for your time. And that's a wrap on this special broadcast. But news continues here on DD India. You can catch all the latest updates on our social media, mobile and digital platforms. Thanks for watching. Bye-bye.
Hey girls! Hi! Congratulations! आज तो पार्टी चाहिए। पहले चैंपियन के साथ सेल्फी लेंगे।
आइडिया, यही करते हैं पार्टी।
पिज्जा पार्टी। ये चल अपना कार्ड और पिन दे।
मेरे कार्ड की डिटेल्स मैं खुद ही डालूंगी। आरबीआई कहता है अपना पिन, ओटीपी, सीवीवी या इंटरनेट बैंकिंग पासवर्ड किसी के साथ शेयर ना करें। ऑनलाइन बैंकिंग सिर्फ अपने कंप्यूटर, मोबाइल और सिक्योर नेटवर्क से करें।
बाय गर्ल्स। कहाँ जा रही है? सुना नहीं। नो शेयरिंग।
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।